Bronchitis and the common cold are respiratory conditions that affect countless individuals each year, often leading to discomfort and time away from work or school. While the common cold typically presents with symptoms like a runny nose, sneezing, and a sore throat, bronchitis is characterized by a persistent cough that can produce mucus as well as chest discomfort and possible wheezing. Treatments for the common cold are usually symptomatic, including rest, fluids, and over-the-counter remedies, whereas bronchitis may require additional medical interventions such as antibiotics if a bacterial infection is present or bronchodilators for easing breathing. Being exposed to tobacco smoke, dust, or chemical irritants, as well as having a weakened immune system, can increase the risk of developing bronchitis, whereas the common cold is often spread through viral infection from person to person. Here's a detailed look at the contrasting features of bronchitis and the common cold to better understand their impacts and management. Affected system, lower respiratory versus upper respiratory. Bronchitis primarily targets the lower respiratory system, inflaming the bronchial tubes that carry air to the lungs, leading to a persistent cough that often produces mucus or phlegm. It can be either acute or chronic, with the chronic form typically associated with long-term irritation or inflammation, potentially due to smoking or repeated infections. Conversely, the common cold affects the upper respiratory system, including the nose and throat. Symptoms are usually milder, such as a runny or stuffy nose, sore throat, and sneezing. Colds are shorter in duration and self-limiting, while bronchitis may require medical treatment, especially if persistent and severe. Understanding the affected respiratory tract regions is crucial for appropriate treatment and management. Symptom duration, weeks versus days. Bronchitis and the common cold may initially present with similar symptoms, such as coughing and a runny nose, yet time often reveals their distinctive paths. A cold typically resolves within a week, whereas bronchitis persists longer, often dragging on for several weeks. This protracted cough, which characterizes bronchitis, tends to be more severe and may be accompanied by mucus production and a wheezing chest. The longevity of symptoms is not merely a calendar count, but a signpost guiding potential treatment plans, from simple rest and hydration for a cold to possibly more targeted therapies for bronchitis, including the use of expectorants or even antibiotics if a bacterial infection is involved. Fever occurrence, uncommon versus rare. Bronchitis and the common cold are both respiratory conditions, but they're differentiated by the presence of fever, among other symptoms. In bronchitis, which affects the bronchial tubes, fever is uncommon but can occur, particularly if the condition is acute or has led to a secondary bacterial infection. In contrast, a fever is rare with a common cold, which is a viral infection targeting the upper respiratory tract. While both conditions can present with cough and congestion, the presence of fever can hint at the body's heightened immune response, potentially indicative of bronchitis. It's essential for healthcare providers to distinguish between the two, as this influences the treatment approach and expected recovery time. Predominant symptom, productive cough versus nasal congestion. Bronchitis typically presents with a productive cough, signaling inflammation of the airways that causes mucus buildup and compels the body to expel it through coughing. This symptom distinguishes bronchitis from a common cold, where nasal congestion is more prominent, alongside possible runny nose and sneezing. With a cold, the respiratory symptoms are upper respiratory tract related, while bronchitis indicates a problem further down in the bronchial tubes. It's this deeper cough, often accompanied by chest discomfort and possibly wheezing, that serves as a clue for healthcare providers to consider bronchitis in their diagnosis over a common cold. Commonality, frequently chronic versus typically self-limiting. Bronchitis and the common cold may share symptoms such as coughing and a sore throat. However, bronchitis characterized by inflammation of the bronchial tubes often persists longer and can become chronic, especially in smokers or individuals with repeated exposure to irritants. Chronic bronchitis, a type of COPD, requires medical attention and is not self-resolving. In contrast, the common cold, usually triggered by rhinoviruses, is self-limiting, meaning it typically resolves on its own with rest and supportive care. Distinguishing between the two is essential for appropriate treatment. Chronic bronchitis might need inhalers and other long-term therapies, whereas the common cold benefits from hydration and over-the-counter remedies.